Hello, everyone. Kimsey here, coming on for our weekly live talk today. Today, I'm going to be talking about what your doctor probably won't tell you about depression. So, before I get into it, I want to welcome everyone. Hey, so glad that you're here. My name is Kimsey. I am the moderator of and the I don't know, owner is the right word, of the Facebook group Holistic Solutions for Mental Health and Wellness. I created this group. It used to be focused on chronic disease. Now it's focused specifically on mental health. I created this back in 2020. So I am the moderator of the Facebook group Holistic Solutions for Mental Health and Wellness. And I also own and run an online nutrition and wellness practice called Progressive Health and Wellness, where I work with ambitious men and women who are struggling with their mental health and performance by taking a root caused body mind approach to optimize physical and mental health. And I go live every week on an educational topic around holistic solutions for mental health. So today, in talking about what your doctor won't tell you about depression, I'm going to paint a little picture. And this is really speaking to the people that feel depressed often. Maybe you've been diagnosed with depression. There's a spectrum of depression. So I'm going to put that out there right up front. There's everything from anhedonia, which is struggling to find joy in things that used to bring you joy, up to major depression. And then there's subcategories too, like bipolar disorder, for example. So I'm focusing on the kind of that whole spectrum, really, with the exclusion of bipolar disorder. So I'm going to focus on the anhedonia, where you're having episodes, or maybe it's starting to affect your life more and more frequently, of lack of finding joy in things that used to bring you joy, having more frequent depressive thoughts, feeling inadequate, low self-esteem, not feeling happy or fulfilled in your life, feeling lonely, up to, a diagnosis of major depression. And, this is for the people where that feeling resonates. And maybe you've talked to your doctor and you may be, tempted to start psych meds, antidepressants, but at the same time wish there was a different way or would prefer a more natural or holistic route. And the problem that I often hear clients expressing is they aren't necessarily told that there is another way by their doctor. They're not told why they feel this way, especially anxiety and depression. It feels like a mood, mental, emotional issue only, when the reality is it is very often rooted in the body. It's rooted in the physiology. And so sometimes they feel like antidepressants are their only choice to not feel depressed anymore. And that's what I want to talk about today, is talk about, when I say it's rooted in our physiology in the body, what does that mean? What biochemical imbalances are manifesting as depression? And that's the other thing that, people are often told by their doctor, or maybe they read on their own, that depression is a chemical imbalance, but there's no elaboration as to what chemicals are imbalanced and what's causing the imbalance, right? Why are they imbalanced? And so that's what I'm going to talk about today. I'm going to center around what the growing body of evidence is showing links depression to inflammation. So that's the whole topic that we're going to cover today, is the inflammation depression link. I'll explain what inflammation is to define it, because that can be often difficult to define for some people. So I'll explain what inflammation is. I'll explain how it affects the brain, how it leads to this chemical imbalance, amongst other things, some of the biggest environmental sources of inflammation, and then some solutions that you can start to implement into your life, nutritionally, lifestyle, to help support brain health and mood. So the inflammation Depression connection. One of the ways that this was first identified is people were given in research studies, they were studying the efficacy of antibiotics, and they found that the people taking the antibiotics as opposed to the placebo noticed improvements in their depression. They noticed a lessening of depressive symptoms. That's part of how that got the wheels generating into establishing what that link might be, right? Is it what came first, the chicken or the egg? So the not clinical, the scientific term for the inflammation depression connection is the cytokine model of depression. Cytokines being chemicals that the immune system releases to mediate the inflammatory response. So I want to start by defining inflammation, because oftentimes when I ask people, how would you define inflammation? I'll often hear words or descriptors like pain, redness, swelling, heat, which can be true with certain types of acute inflammation. But with chronic inflammation, we often don't see those qualities. So rather, inflammation, to define it, is the immune system's response to injury or infection. We know that there's 3 different categories of injury. The first category is chemical injury. So some examples of this would include nutrient deficiencies, hormone imbalances, toxin exposure, like mold or pollutants in the air we breathe, the water we drink, the food we eat, processed food, diet. Those are some examples. Food sensitivities, allergies. Those are some examples of chemical injuries. You may hear me today, by the way, use the word stress and injury interchangeably. So the second category is physical injury or physical stress. So some examples of this would be surgery, pregnancy and labor, concussion or traumatic brain injury, physical injuries, right? So like broken bones, sprained ankles, things along those lines. And then the last category is emotional injury. And here, this includes both the day in, day out stressors like juggling work and kids and bosses and traffic and things like that. And then also the more insidious stressors like loneliness, lacking meaning and purpose in life, experiencing trauma as a child, divorce, death of a loved one. So inflammation gets a really bad rap, but it's not inherently a bad thing. We need the inflammatory response. And to be clear, inflammation, biochemically speaking, is when immune cells release certain chemicals like cytokines and chemokines to try to destroy a perceived threat, an antigen of some kind. So that antigen could be a bacteria, it could be a mold toxin, it could be a heavy metal, right? Whatever it might be, but releasing cytokines to try to destroy a perceived threat. And those cytokines, certain types of cytokines, create the kind of an inflammatory response that we're familiar with. The problem with chronic inflammation is it's degrading to the rest of the body. And innocent tissue can get caught in the crossfire. So innocent tissue can be damaged by the inflammatory response, which then that injured tissue becomes a source of injury that further fuels the inflammatory response. And so it kind of becomes this vicious cycle. The immune system struggles to turn off, even if the original battle has already been fought and is done. So chronic inflammation is the problem rather than acute. And with chronic, even with inflammation in general, it's how the body heals itself. It only becomes a problem when the level of injury supersedes the body's ability to resolve it. So when we're talking about the connection between inflammation and depression, I want to share 3 different ways that inflammation affects the brain and manifests as depression. The first is inflammation will increase cortisol levels. So one of cortisol's main jobs is to balance or tame the immune system. We can appreciate this when by the understanding that cortisol is further converted into cortisone. We've turned cortisone into a medication to fight inflammation, right? So we can appreciate the immunosuppressing activities of cortisol. It helps calm the immune system down or suppress immune activity or suppress inflammation. So the reverse of that is if inflammation is chronically elevated, so is cortisol. Now, cortisol, just like inflammation, is not inherently bad, but it becomes problematic when it is chronically elevated, and especially when it starts to lose its diurnal circadian rhythm. So normally cortisol is highest in the morning to help us wake up, and it's lowest at night so that we can go to sleep. We'll have intermittent spikes throughout the day in response to emotional stress, physical stress, or chemical stress. But if cortisol is chronically elevated, then that has a trickle down effect of ramifications. So one of those is the brain. We're basically stuck in the fight or flight response. And so imagine for a minute if you're running frantically, you're in a dark alley at night and someone jumps out and scares you and you're running and trying to get away. You can imagine the mental state that one would be in, right? Anxiety, panic, worry, fear. And so that will still, even if we are not running from a literal fear for our life, we're still running from a perceived threat with cortisol being elevated is what I'm saying. And so neurochemically, it will mimic that. It will mimic running from a perceived threat. So we'll see higher levels of epinephrine, for example, or norepinephrine. Cortisol has an impact on the brain as well and neuronal signaling, which I'll get to more in just a minute. And we'll see low and higher levels of glutamate, higher levels of even histamine, because histamine is also a neurochemical in addition to mediating the allergic response. And then lower levels of serotonin and of GABA and acetylcholine, as acetylcholine is the primary parasympathetic neurotransmitter. So elevated cortisol directly impacts our neurochemistry. What goes up must come down. So when the stress response is chronic, people start off in an alarm phase of this nervous system dysregulation. They start off in an alarm phase, which quite literally is higher cortisol, higher adrenaline levels, more of an agitated arousal state, but then eventually burn out. And that leads into more, actually can be parasympathetic dominance. As speaking to the understanding of polyvagal theory and the nuanced understanding of the parasympathetic nervous system that we have. But it's a dorsal vagal shutdown response, in other words. So that is where depression tends to become more prevalent. So I'm making the connection between how chronic inflammation leads to chronic elevated cortisol levels that starts off as the alarm phase of the stress response, but then can lead into the burnout, dorsal vagal burnout, in which case depression is very prominent. So that's one way. The second way that I want to talk about, and it's not limited to these three ways, but I feel like these are the most relevant. The second way that inflammation affects brain chemistry in depression is through a process called dendritic pruning. So neurons, the way that they communicate and send electrochemical messages, so how we're able to blink our eyes and move our arm and digest food and breathe and think and feel, is through this electrochemical communication. The way that works is the presynaptic neuron. So we'll just say the initiating neuron for simplicity's sake. There's an axon, and then there's dendrites, and the dendrites kind of look like little trees. And those dendrites connect to the next axon, and then, that leads to the dendrites, and then the next axon, and so on. And that electrochemical message is transmitted down the nervous system from one neuron to the next. Where the dendrites meet, in between is a tiny little space called the synaptic cleft. And in that space, so the dendrites will release the axon will release the neurochemicals called serotonin, and then that connects to the dendrites. And so more neuronal connections that we have, more plasticity that there is. So more brain growth and capabilities, nervous system growth and capabilities. Dendritic pruning occurs when, as the name implies, right? Dendrites are kind of like trees when you look at them, pruned trees. That connection starts to wane, it weakens. And if there's not a connection, a message cannot be sent. So dendritic pruning means a loss of neuronal connection. This will manifest differently in different ways depending on where this is happening in the brain. This is affecting memory, for example. Is this affecting cognition and focus? Is it affecting mood? And so, especially when this happens in the frontal lobe, or especially in the frontal lobe, they call it a spreading depression, but that can manifest as depression. So, inflammation causes that. Inflammation causes that dendritic pruning. And this is why people, well, not exclusively why, but this will contribute to other experiences too. So depression being one, but people may also notice brain fog or poor cognition, poor focus, poor sleep, tired, apathy, right? There can pain even. There can be a number of other symptoms that come along with that due to that dendritic pruning. Now, the beauty is those dendrites, so we can regrow neurons. We used to think that we couldn't, but in the hippocampus, in the olfactory bulb, like we're growing new neurons slower as adults than as kids. But we never lose the ability to grow new neuronal connections. It's called arborization, or, so we can always grow new neuronal connections. So we can restore that, but we obviously don't want to be losing any either. And part of the reason this happens is, maybe I should have started with this too. I'll get to that in a minute. I'll explain the mechanisms of brain inflammation in the brain, microglia cells, and how it's initiated. So going back to, we want to preserve our dendritic connections, our neuronal connections. And I'll get to how to do that towards the end of this talk. Number 3, how inflammation affects our neurochemistry is it directly alters our neuronal balance. So I started to hint at this with cortisol, but inflammation will do this too, as not just the cortisol mediated, but I was talking about how it disrupts the balance of neurotransmitters. So different neurotransmitters. I've heard it described this way. So we've got many different neurotransmitters. There's serotonin and dopamine and norepinephrine and acetylcholine and epinephrine and histamine and GABA and glutamate. We have dozens of different types of neurotransmitters. And it's the combination of them that's released into the body and nervous system at any given time that influences how we feel, our mood. So I had it described as if you've got all these different colors of paintbrushes, and then you start splattering a piece of paper with different colors of paint, right? Let's say on one painting, you might have a lot of blue and some purple and then a little bit of green, yellow, and orange. And then on another piece of paper, you might have a lot of orange and yellow and pink. And then, right. And so it looks different. And that's essentially how it is on our body. The different combination of these neurochemicals at any given time will influence how we feel in our mental, emotional state. So if we have a painting, for example, that has a lot of glutamate and histamine and epinephrine and, these more like excitatory, in other words, neurotransmitters, and a lack of GABA and serotonin and dopamine or norepinephrine, then that can create imbalances that can lead to depression. So that neurochemical balance, and again, if in the presence of chronic inflammation, the body and brain basically think that they're constantly fighting a battle. So there's a propensity for that excitatory neurochemical mix because the nervous system thinks that we're trying to escape a threat. So you can think of it like that. Right. If we're running from a lion, it's not the right time to feel relaxed, centered, and calm. Right. That's not a problem if you're legitimately running from a lion for 10 minutes. But if you're running from a lion for, 6 years, then it's a problem. Okay, next, so those are just a few of the ways that chronic inflammation is linked to depression. And please know too, I'm sharing this in lay speak. I can get into the chemistry of it. I've posted links into my Facebook group to research articles that talk about this, but I want it to be understandable for the average person. So, lastly, I want to talk about how how brain inflammation is a little bit different than body inflammation, but how the two are related. So, the brain has a whole support network called glia cells. So, for every one neuron, which is a nerve cell, we have 10 glial cells. There's astrocytes and oligodendrites and microglia cells. And microglia are like the brain's immune system. So because neurons are so sensitive and so delicate, and we don't replicate them all that readily compared to other cells, like in the digestive tract, we have basically a whole new digestive tract every week. It's replicating so quickly. So because of that, the microglia cells encapsulate the neurons and are protective. The microglia, the brain's immune system, are also very trigger happy. So certain things, the brain is protected in the skull by what's called a blood-brain barrier. It's a very dense capillary system that only allows certain things to be escorted into the brain or small particles and amino acids to be absorbed or cross the blood-brain barrier. And so when the microglia cells sense some kind of antigen, some kind of insult, something that's not supposed to be there, then they release those pro-inflammatory cytokines I was talking about before. One of the problems is they don't have a great off switch. So when these pro-inflammatory cytokines are released, they can also, innocent tissue, just like in the rest of the body, but innocent tissue, neurons, other glia cells can get caught in the crossfire. That is what contributes to that dendritic pruning I was talking about before, and the upset in neurochemical balance and the release of cortisol, amongst other things. But they don't have a great off switch. So this chronic inflammation in the brain can be initiated, and it's difficult to turn off on the body's own accord. And this is where we can tap into our environment to help establish or reestablish balance and help turn off that inflammatory response. The other thing I want to mention is brain inflammation can lead to body inflammation. It's called neurogenic inflammation. And body inflammation can lead to brain inflammation. So certain types of immune cells are able to cross the blood-brain barrier, where they can, then mediate inflammation in the brain too, from the body to the brain. Okay, so what is causing this inflammation? Now, it's a loaded question. Again, I talked about examples, right? There's categories: the chemical inflammation or the chemical injury, the physical injury, the emotional injury. So there's a lot of things, and that ultimately we look at your bucket as a whole. Is your inflammatory bucket overflowing all the time? Or do you have great nutrition and lifestyle principles in place that will help drain that bucket if it starts to creep up towards the top? But some of this is where genetics play a role, but environment pulls the trigger. So genetics determine how big your bucket is, right? How many different environmental insults can you tolerate before you'll start to get symptoms? And they also determine what manifests when your inflammatory bucket overflows. Environment ultimately pulls the trigger, though, which means that two people can have genetics, maybe a strong family history of depression. One experiences it, one doesn't, based on their environment. So, what are some of the factors that we know contribute to inflammation in the brain? Nutrition is huge. The brain only weighs 2% of our body weight, but it gets 20% of our fuel supply. The brain is extremely sensitive to nutrient status. So more and more studies are coming out, but especially the one recently that was released in the past few months, linking ultra processed foods to depression. We have been able to make that connection for a long time, but this study is a nice one to see and corroborate. And so ultra processed foods, the sugar, the refined fatty acids, the higher omega-6 fatty acids, the void of nutrients, the um, trans fats are really being minimized. They were outlawed a few years ago. Mm. But did I say sugar? The artificial preservatives, artificial um, colorings and flavor enhancers and all those things in processed foods, that negatively impacts the brain. That causes inflammation. A diet high in omega-6 fatty acids. So eating a lot of foods that have canola oil or soybean oil or corn or safflower, or eating even good foods, nuts and seeds are high in omega-6s, certain grains are high in omega-6s, but not offsetting that with a healthy intake of omega-3s. Omega-3s are found in like hemp seed and chia seed, flaxseed, fatty fish, certain algae. And so this tend to be, lacking in at least the standard American diet. So it's very easy to get higher omega-6s to omega-3s, and the 6 to 3s will skew prostaglandin and eicosanoid balance that promotes, therefore, inflammation in the brain and body. So diet, poorly balanced blood sugar. I've talked a lot about how blood sugar imbalance affects brain health. If you want more information on that, about how both high and low and like blood sugar swings throughout the day affect it, search my Facebook group, just search blood sugar and it'll come up. So poorly balanced blood sugar is a big one. Let's see what else. Lacking protein, a lack of protein. So amino acids are needed to manufacture our neurochemicals, right? Tryptophan is an amino acid, becomes serotonin in the brain. Tyrosine is an amino acid, it becomes epinephrine, norepinephrine, and dopamine. So we need amino acids from protein to support our brain chemistry, like directly. So nutrition plays a really big role. We've also got like food sensitivities, right? If you're gluten sensitive or dairy sensitive, that has also been shown in the literature to drive mental health and affect mental health, including depression. So nutrition is one. Sedentary lifestyles, not moving. So physical movement, and I don't care, you don't have to go to the gym for an hour. It doesn't have to be like formal exercise, but just moving your body it supports brain-derived neurotropic factor. That is how we regrow our neurons. That is how we regrow those dendritic connections. It's one way. Exercise is phenomenal, as is learning new things. That's another way to support that connection. Learning and just doing new things. Brush your teeth with the opposite hand, take a route home that you don't normally take. Just doing and learning new things is another way. But exercise is huge for reducing brain inflammation. Exercise increases endorphins, it increases serotonin and dopamine, it lowers blood sugar, it lowers cortisol. Exercise is huge. And then, so sedentary lifestyle, in other words, poor gut health. Poor gut health is massive. So 90% of the serotonin in our body is made in the gut. 50% of the dopamine is made in the gut. If you have digestive symptoms and struggle with depression, there's absolutely a link. I'm just going to say it that strongly. Like, yeah, there's a link. It might not be the only thing, but there's absolutely a link. So inflammation created by the gut inflammation leads to brain inflammation. Imbalances in the microbiome leads to imbalances in our brain chemistry and inflammation. Nutrient deficiencies based on poor absorption. There's like a whole 9 yards. Leaky gut leads to leaky brain. I mean, there's connection after connection after connection to make. If you take medication, so if you take antacids, for example, or frequent antibiotics, certain medications for digestive health, there's even, I'm blanking on the name of the medication. It's a medication for IBS that acts on serotonin. So again, direct connection. And then from there, so chronic stress is another big one as to what's causing inflammation. Nervous system dysregulation, where our nervous system is basically responding to past stressors in the present moment. Chronic stress is huge. So those are three big ones that we always work on up front: nutrition, nervous system regulation, and gut health. Those are the three pillars that every single one of my clients we address. For some people, that's it. For some people, that fixes like 95% of their problems. For others, we go deeper. And that's where we start looking into toxin exposure, like mycotoxins or heavy metals or forever chemicals in the environment, like BPA and formaldehyde, for example, hormonal imbalances, um, other infections like for some people it might be Lyme or Epstein-Barr or herpes simplex 6, or there can be other types of infections. So again, going back to what's causing inflammation in the brain and body, you have to zoom out. But I would really, if you're watching this right now, I would really focus on nutrition, nervous system regulation, and gut health. Those three pillars will move the needle the most and necessarily provide a strong foundation by which we can go deeper if needed. Okay, so for lab tests, what are some of the lab tests that we look at? We look at blood chemistry on pretty much everyone. So we're looking at what does thyroid look like? What about nutrient status? We look at zinc, we look at copper, we look at vitamin D and magnesium, electrolytes. We look at blood sugar balance and metabolic tendencies. We measure inflammation through C-reactive protein and homocysteine, and then also looking at white blood cell activity. Iron is another nutrient that we look at. So there's a lot. We look at the detox pathways, looking at liver enzymes, kidney function. So there's a lot that you can learn about what may be contributing to your depression by looking at like fairly routine blood chemistry, albeit the panel that we run is like far from routine, but I'm sure even in your routine blood work, we could find really meaningful information that could give us answers as to what's causing your depression. So we look at blood chemistry a lot. We look at stool testing. We run the GI map stool test all the time and look for things like H. pylori and parasites and fungal overgrowth and just general dysbiosis, imbalances in the gut microbiome, malabsorption, inflammation. We look at, sometimes we'll run organic acids and look at nutrient status or toxin exposure. We'll run hormones and look at cortisol levels, estrogen, progesterone, testosterone. We'll run mycotoxin tests. So I'm starting with, we look at blood chemistry for sure, stool testing for sure. And then from there, it really depends on the person, right? Sometimes we look at food sensitivities or SIBO testing or hormone testing or mycotoxin. So it depends on the person. But again, I'm going to keep redirecting to the bucket that is inflammation. Inflammation is the immune system's response to injury. 3 categories of injury: chemical, physical, and emotional. The bucket is your bucket overflowing. What is overflowing it? That's where the lab testing comes in. How can we drain the bucket? We punch big holes in the bucket by optimizing nutrition, nervous system regulation, and gut health. And then from there, we poke more smaller holes based on the person's unique needs: metals, mold, hormones, etc. Okay, so let's see, lifestyle recommendations in nutrition. So with nutrition, I would really encourage starting to shift towards whole foods at the very least, like quality, really start limiting, if not completely avoiding, foods that have a laundry list of ingredients where you can't pronounce half of them or you don't know what they are. If there's a lot of refined oils like soy oil or corn or cottonseed or safflower, canola, avoiding or really limiting those oils. And then starting to focus on anti-inflammatory foods as well. Oh, limit sugar. There's another big one. Limit sugar. So sugar from whole food sources, like if you eat fruit, that's fine. But try to limit added sugar where there's like sugar in the ingredients list as much as possible. And then I've given a lot of talks around anti-inflammatory elimination diet. So look into diet nutrition plans like the Mediterranean diet, the paleo diet. Both of those provide a really solid framework and focus on whole foods, complex foods, nutrient dense foods. I won't go into detail about those here, but I'll give you those as resources to focus on those. I do have an online course. It's 4 weeks. It's called Let's Start with Food, and I'm happy to share that with people. It will walk you through an anti-inflammatory nutrition plan. You can watch it on your own time. So anti-inflammatory diet, start incorporating movement every day. Every day, incorporate some kind of movement. It could be a half-hour walk. You could do it in 3 10-minute chunks. It could be hiking. It could be gardening. It could be swimming. It could be going to the gym. It could be taking an exercise class. It could be biking. It can be anything. It doesn't have to be, going to the gym for an hour. I often recommend a 10-minute HIIT workout for my clients. So it can be simple, but some kind of movement every day, and even better is if it's outside. And then breath work for the nervous system regulation. 5 minutes. What I recommend for my clients to start doing is 5 minutes of what's called heart-focused breathing. So set a timer on your phone, and for 5 minutes, place your hand on your belly, one on your chest, breathe in through the belly, not the chest, breathe in through your nose, and a physiological sigh out, and focus your attention on the heart, and do that for 5 minutes. And that can be really huge, especially if it's done first thing in the morning, for starting to regulate your nervous system. I'm not going to get into supplements today. There are a lot that can support brain health. So like magnesium glycinate has been really effective, L-theanine, 5-HTP, caution with 5-HTP or St. John's wort. If you take an antidepressant, SSRI or MAO inhibitor, then those are contraindicated and you would not want to take that. But this is why I would recommend working with someone before trying supplements to make sure that they don't interact with medications. B complex vitamins can be really helpful. Let's see. GABA can be really helpful. Fish oil is awesome. Zinc can be really helpful. So it really depends. And then, if there are overt nutrient deficiencies, like fixing those, vitamin D is huge. So it really depends, but supplements are a big part of the process, and supplements that support reducing inflammation, especially. So fish oil, vitamin D, turmeric, resveratrol, quercetin can all be really helpful in addition to nutrients like magnesium and like I just shared. All right, everyone. From there, that's where it can be so helpful to get a personalized understanding of your health and what is affecting your depression, because it really becomes bio-individual from there. So that's all I've got for you today. Couple of announcements though. One is if you're watching this or you know someone that is struggling with depression and they're either trying to avoid medication or trying to come off of medication or just support their body while they're on medication, please send them this video. We can set up a free 15-minute call to talk more about the health challenges that you or they are experiencing and what the next steps and action plan would look like. Also, really exciting and backed by popular demand, we are relaunching the Chaos to Calm Anxiety Program. So this is a 90-day program. It's a hybrid of both one-on-one and group coaching, facilitated by both myself and a licensed therapist. It's all online, live coaching classes, online course that is you'll have lifetime access to. But the Chaos to Calm Anxiety Program walks you through those pillars, those foundational pillars I was just talking about. There's a whole month dedicated to anti-inflammatory, nutrient-dense nutrition. The second month, we focus on nervous system regulation and gut health. And the third month, we're focusing on making it last. So reflecting on the changes that you've experienced and how to integrate this into your life so that you maintain the benefits. So I expect people to not only see improvements in feeling less anxiety and having more balanced mood, but also see potential changes in more energy, better sleep, weight loss, better digestion, clearer skin. So early bird enrollment is open now through August. We kick off the day after Labor Day in September. So I'm going to start talking about that and sharing the information more. But if you're interested in the Chaos to Calm Anxiety Program, drop a comment here, shoot me a message on Messenger. It's also on my website, progressivehealthandwellness.com. All right, everyone. Thank you for being here. Have a wonderful rest of your day, and I'll see you next week.